The federal government has now declared a national emergency on the high rate of oil theft. Minister of State for Petroleum Timi Peresiva spoke during a visit to the governor of Delta State, Ifeanyi Okowa. Ikenamechi has more.
Research shows that crude oil theft in Nigeria has increased to a daily average of 180,000 barrels. And at this courtesy visit, the Minister of State for Petroleum, accompanied by the Chief of Defense Staff and Group General Manager of the NNPC, revealed more about the present situation of things, which is necessitating a drastic action.
As a country, we cannot sustain this kind of theft going on in perpetuity. Our production has dropped drastically, and our receipts as government has also correspondingly dropped to very unsustainable levels. So we have decided to take the bull by the horn and put some structures in place to ensure that this menace is stemmed.
For Governor Okowa, the dimension of the criminality has taken a very worrisome level that requires all resources and collaboration to tackle it.
It has become now like a multiple cartel, and those who are actually criminally involved, they have become too powerful for some communities that they are not even able to speak out.
The federal government and NNPC have set up strategy on how to stop the revenue loss of $1.9 billion and want the support of the state governments.
That deferred revenue from this activity of vandals and oil thieves, including losses because we cannot operate our assets, is amounting to close to $2 billion every month. Extensive security intervention program that is going on, led by the Chief of Defense Staff, which requires the collaboration of all state governments. All forms of technology are being applied to make sure that we bring this into control.
It's important that what we're doing now at the moment truly works, because by the time they actually engage local contractors as persons in charge of their surveillance contracts, it gives a reach to us as a state government to be able to truly find a way of putting pressure on those surveillance contractors to truly do their work.
It is hoped that this effort is sustained and everyone culpable, no matter how highly placed, is brought to book to enable the country profit from the high price of crude oil in the international market. Ikenna Amechi, TVC News, Asaba.
Health, are you aware that breast and cervical cancers are among the most frequent and most fatal cancers in women? And that can change with early detection, but access to screening is one of the many problems patients face. And now, to ensure an improvement, the Lagos State Minister of Health has trained health workers on better and adequate services to ensure a reduction in deaths. Inoluwa Pupola has more.
From the early to the advanced stage, cancer is one of the most chronic diseases that happens with abnormal cells growing in the body. For women, the majority of cases are breast and cervical cancer. To bridge the doctor to patient ratio, which currently stands at 1 to 6,000 ratio, the Lagos State Ministry of Health with the United Nations Population Fund are training about 200 health workers on how to create better access to screening services.
The leading causes of cancer mortality in women are just the breast and the cervix, and we are sure we are dealing with. And if we can tackle this, then we are sure that our women will live longer, will be able to protect and provide for their families, and will also have affected a lot of other targets on the SDG.
Healthcare workers are with a relatively high level of cadre, not necessarily the doctors or the nurses can be mentored, can be trained on the basics of how to screen clients so that we can fill the gap.
With the increasing population, there is need for sensitization on how to practice self-examination and detect early signs.
We can't really say that you can totally prevent it like that. But we always say that the best way to actually prevent having cancer is to screen, and screen early. screen regularly and screen early. We have 15 general hospitals, and then we have our tertiary facility, LASUS, providing these services free of charge.
The participants also had a practical session that would ensure a better practice going back to their various centers.
Every woman that walks, every female that walks into the facility, that we should ensure that we screen them.
Breast screening, for example, which has to do with telling our clients to do self-breast examination.
With recent efforts from the Lagos State government to make cancer screening more accessible, it is also focused on the aftercare services to ensure an overall quality healthcare experience. Inioluwa Popola, TVC News, Lagos.
The rise in cases of monkeypox in the country, as the Nigeria Center for Disease Control says, the number of cases has now risen to 157. In a situation report for week 30, the NCDC said the cases were recorded across 26 states since January. According to the Center for Disease Control, 56 suspected cases were reported in 19 states last week, with Ondo topping the list after recording 13 cases. The NCDC said 4 deaths were recorded in Delta, Lagos, Ogun, and Akwa Ibom states from the 1st of January to the 31st of July 2022. Monkeypox is a rare virus zoonotic infectious disease transmitted from animals to humans that occurs sporadically, primarily in remote villages of Central and West Africa near tropical rainforests. Nigeria is one of the countries in Africa where the disease is endemic. In other news, an initiative promoted by the federal government with support from the UNDP has identified steps Nigeria needs to take to achieve development. And this was contained in a report presented to journalists in Abuja at the end of a foresight study. The group listed 5 recommendations, from building a culture of innovation to Nigeria taking the leadership role in Africa. Moyo Thomas was there.
The Imagine Nigeria initiative believes Nigeria has the potential and opportunity to be a prosperous, cohesive and dynamic country, only if every citizen works together to build the nation. It acknowledges this despite the current challenges of violence, insecurity, dwindling economic downturn, and other negative factors.
So I'll start with myself.
The initiative says inclusive governance and technology are 2 important factors Nigeria needs to achieve this. It urges every citizen to play its part and begin conversations that could gear citizens towards performing their civic responsibility.
What do we want our country to be? How can it be this wonderful thing that we want it to be? These are the 5 ways that we can do that. A, we can build a culture of innovation. B, we can decide to stimulate a green economy. C, we should lead Africa. D, we should build trust in society. E, we should facilitate national narratives.
It is not for us to hold ourselves back. It's for us to think, to say, okay, the world is changing, and where the world is going, can we get there first? Maybe not in solar panel, maybe not in wind energy, but what are the other areas that we can get to first? And can we identify these? And how do we work with our private sector to begin to put in place the necessary investments? How do we work with our policymakers to put the right policy incentives in place so that we can drive development in this area? And we can become global leaders in certain areas.
What we've kind of landed on are ideas that we feel, should be almost kind of above politics, that should be ideas that no matter what political persuasion that you belong to, are ideas and concepts that should be all of our concerns.
The initiative agrees that for Nigeria to achieve lofty heights and a country that works for all citizens, there is need to build trust and change the narrative. A website that will further propel engagement with civil society organizations and other Nigerians on this initiative will be launched on Wednesday. Moyo Thomas, TVC News, Abuja.